The FDA authorizes the Pfizer COVID vaccine for kids as young as 12. Infectious disease expert Dr. John Bradley from Rady Children's joins us with more. Dr. Bradley, hi, I miss you.
Hello, Sally. Very nice to be talking to you again.
We have talked and gone through this whole entire journey. I remember sitting with you last year talking about when COVID was first out, and now we're talking about vaccinations, and not just vaccinations, but in children.
Yes, I'm really excited about this.
This news coming out for younger children, 12 years old. Why is it so important to get this younger group vaccinated, especially when we're having the conversations that we're now learning they're not as likely to be getting extremely sick or to spread it?
There's a really good reason to try and immunize them, and that has to do with both herd immunity, that we want to get vaccination levels in the community up so that coronavirus stops spreading. And we know if the masks come off, it will start to spread because there's so many susceptible people. And there's 165,000 12 to 15-year-olds in San Diego County. And if we immunize them all, then the virus will not spread nearly as effectively. And as you know, you can have asymptomatic infection in these kids, which is more common than adults. So if all the kids are immunized, we're not spreading virus without even knowing it.
When these vaccines first came out, and we're still seeing pushback from a group of people who say they don't want to get the vaccine. You start with the adults, you do the research, it's come out an unprecedented amount of time, and usually the children and kids are the last ones to see these vaccines. Understandably, there are a lot of parents who are concerned about side effects and what this will do to their kids. You are a children's doctor. What would you say to them?
So there's a difference between younger children under 12 years of age and adolescents who are 12 to 15. And the FDA has looked at adolescents a bit differently than the younger kids. Clearly, a 1-year-old or a 2-year-old is not the same as a 14-year-old. So for most drugs and vaccines now, the FDA is including 12 to 15-year-olds in the adult trials because physiologically they're very similar. And that's what we saw with this Pfizer coronavirus vaccine, that the 12 to 15-year-olds were an addendum to the original authorization. So the FDA didn't have to start from scratch under 16. They were able to include the 12 to 15-year-olds, and they got 2,000 kids that age that were fully analyzed and are being tracked to show that the vaccine works just as well. It's just as safe in the 12 to 15-year age group as it is in the adults. But you're right, for the children under 12, it's a whole different ballgame. And each age group under 12, 6 to 12, 2 to 6, under 2 and down to 6 months of age, each group will have its own investigation. So you won't see vaccine for children under the age of adolescence until the very end of this year or early next year.
And we're tying a lot of the reopening of the schools to getting these kids vaccinated as we go down these tiers, correct?
Yes. And although I think safe return to school is actually already within our grasp, if we can immunize these 12 to 15-year-olds, then the concern and worry that something might not work right doesn't have to be a concern. These kids can get back. These kids can socialize. I mean, 12 to 15-year-olds, they socialize. That's what kind of creatures they are. And they've been in lockdown for a year. So this vaccine will allow sort of normal human behavior to happen, which is just marvelous.
San Diego is making some big strides in meeting their goals of people who are fully vaccinated here. But Dr. Bradley, we've been talking about this for a year now, and you see it a lot on social media. People still questioning the safety of the vaccine, saying vaccines take years and years to test and make sure everything is okay. And this is just coming out. Is it safe? Is it safe? Is it safe? Is the vaccine, do you think, safe given everything that you know?
Yes, so there are millions of people who've been treated with the Pfizer vaccine and the Moderna vaccine. And there's been no vaccine where the FDA has had so much information so close to the immunization of populations in history. And the FDA and the CDC are tracking that very carefully. And there's now virtually complete 6 months data from the original Pfizer studies that was shared with the FDA and CDC. And there's no safety signal. And everyone who's been immunized can report any side effects. And those are all being tracked and are reported from out of the CDC. And there's no safety problem. So after tens of millions of doses of vaccine, I think the people that were worried when the vaccines were first authorized in December, people who were worried there might be something, I don't think they need to worry anymore. There's no safety signal that's shown up in any of these vaccines. And the FDA keeps looking. And there's a 1 in a million side effect that normally doesn't even show up in any vaccine studies that you know about with the Johnson & Johnson vaccine that's very similar to the AstraZeneca vaccine. But the one that's being approved for adolescents is the Pfizer vaccine. Mm-hmm. So none of the problems with the others have been tied to Pfizer.
Okay. So those are for the 12 and above. I'm hoping you can help me answer the question for my little boy, and I'm sure a lot of little ones have this question too. Said, Mommy, when am I going to get my shot? When do I get my vaccine for the little kids? When do you think? You think by the end of the year?
Those studies are actually underway right now. So yes, Pfizer has predicted that pediatric vaccines will be authorized for children by the end of this year or early next year.
Dr. Bradley, it was so good to see you after all this time. Thank you.
Thank you very much, and I'm looking forward to having everyone who's listening to you, all of their kids immunized that are between 12 and 15. We start the immunization programs tomorrow after the CDC ACIP meets, and there's a recommendation for the vaccine that follows this authorization.
Okay, all starting tomorrow. Dr. Bradley, thank you.